Introduction. Diabetes, also known as diabetes mellitus, is a group of metabolic disorders characterized by a high blood sugar level, hyperglycemia, over a prolonged period of time. Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar, glucose, levels to be abnormally high. Symptoms: feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine, feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow healing sores. Types of diabetes. Type 1 diabetes. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but can develop at any age. It was once better known as juvenile diabetes. People with type 1 diabetes need to take insulin every day. This is why it is also called insulin-dependent diabetes. Type 2 diabetes. This is the most common type of diabetes. Up to 95% of people with diabetes have type 2. It usually occurs in middle-aged and older people. Other common names for type 2 include adult-onset diabetes and insulin-resistant diabetes. Prediabetes. This type is the stage before type 2 diabetes. Blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Gestational diabetes. This type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. Drug or chemical-induced diabetes. Examples of this type happen after organ transplant, following HIV/AIDS treatment, or are associated with glucocorticoid steroid use. Causes. Cause of type 1 diabetes. This is an immune system disease. Your body attacks and destroys insulin-producing cells in your pancreas. Without insulin to allow glucose to enter your cells, glucose builds up in your bloodstream. Cause of type 2 diabetes and prediabetes. Your body's cells don't allow insulin to work as it should to let glucose into its cells. Your body's cells have become resistant to insulin. Your pancreas can't keep up and make enough insulin to overcome this resistance. Glucose levels rise in your bloodstream. Cause of gestational diabetes. Hormones produced by the placenta during pregnancy make your body's cells more resistant to insulin. Your pancreas can't make enough insulin to overcome this resistance. Too much glucose remains in your bloodstream. Diagnosis. Fasting plasma glucose test. This test is best done in the morning after an 8-hour fast. Nothing to eat or drink except sips of water. A1C test. This test, also called HbA1c or glycated hemoglobin test, provides average blood glucose level over the past 2 to 3 months. Oral glucose tolerance test. In this test, blood glucose level is first measured after an overnight fast. Then you drink a sugary drink. Your blood glucose level is then checked at hours 1, 2, and 3. Gestational diabetes tests. There are 2 blood glucose tests if you are pregnant. With a glucose challenge test, you drink a sugary liquid and your glucose level is checked 1 hour later. Random plasma glucose test. This test can be done anytime without the need to fast. Type 1 diabetes tests, the blood is checked for autoantibodies. The urine is checked for the presence of ketones. These signs indicate type 1 diabetes. Complications. Long-term complications of diabetes develop gradually. Possible complications include heart and blood vessel, cardiovascular, disease. Diabetes majorly increases the risk of many heart problems. These can include coronary artery disease with chest pain, angina, heart attack, stroke, and narrowing of arteries, atherosclerosis. Nerve damage, neuropathy. Too much sugar can injure the walls of the tiny blood vessels, capillaries, that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Hearing impairment. Hearing problems are more common in people with diabetes. Kidney damage, nephropathy. The kidneys hold millions of tiny blood vessel clusters, glomeruli, that filter waste from the blood. Diabetes can damage this delicate filtering system. Eye damage, retinopathy. Diabetes can damage the blood vessels of the eye, diabetic retinopathy. This could lead to blindness. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of many foot complications. Skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Depression. Depression symptoms are common in people with type 1 and type 2 diabetes. Complications of gestational diabetes. Most women who have gestational diabetes deliver healthy babies. However, untreated or uncontrolled blood sugar levels can cause problems for you and your baby. Complications in the mother. Preeclampsia. Symptoms of this condition include high blood pressure, too much protein in the urine, and swelling in the legs and feet. Gestational diabetes. If you had gestational diabetes in one pregnancy, you're more likely to have it again with the next pregnancy. Complications in baby. Excess growth. Extra glucose can cross the placenta. Extra glucose triggers the baby's pancreas to make extra insulin. This can cause your baby to grow too large. It can lead to a difficult birth and sometimes the need for a C-section. Low blood sugar. Sometimes babies of mothers with gestational diabetes develop low blood sugar, hypoglycemia, shortly after birth. This is because their own insulin production is high. Type 2 diabetes later in life. Babies of mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Death. Untreated gestational diabetes can lead to a baby's death either before or shortly after birth. Treatments. Type 1 diabetes. If you have this type, you must take insulin every day. Type 2 diabetes. If you have this type, your treatments can include medications, both for diabetes and for conditions that are risk factors for diabetes, insulin, and lifestyle changes such as losing weight, making healthy food choices and being more physically active. Prediabetes. If you have prediabetes, the goal is to keep you from progressing to diabetes. Treatments are focused on treatable risk factors, such as losing weight by eating a healthy diet and exercising, at least 5 days a week for 30 minutes. Gestational diabetes. If you have this type and your glucose level is not too high, your initial treatment might be modifying your diet and getting regular exercise. If the target goal is still not met or your glucose level is very high, your healthcare team may start medication or insulin. Oral medications. Sulfonylureas. These drugs lower blood glucose by causing the pancreas to release more insulin. Glinides, also called meglitinides. These drugs lower blood glucose by getting the pancreas to release more insulin. Biguanides. These drugs reduce how much glucose the liver produces. Alpha-glucosidase inhibitors. These drugs lower blood glucose by delaying the breakdown of carbohydrates and reducing glucose absorption in the small intestine. Thiazolidinediones. These drugs improve the way insulin works in the body by allowing more glucose to enter into muscles, fat and the liver. GLP-1 analogues, also called incretin mimetics or glucagon-like peptide-1 receptor agonists. These drugs increase the release of insulin, reduce glucose release from the liver after meals and delay food emptying from the stomach. DPP-4 inhibitors, also called dipeptidyl peptidase 4 inhibitors. These drugs help your pancreas release more insulin after meals. Dopamine agonist. This medication lowers the amount of glucose released by the liver. SGLT2 inhibitors, also called sodium glucose cotransporter 2 inhibitors. These drugs work on your kidneys to remove glucose in your body through your urine. Bile acid sequestrants. These drugs lower cholesterol and blood sugar levels. Types of insulins for diabetes. Rapid-acting insulins. These insulins are taken 15 minutes before meals, they peak at 1 hour and work for another 2 to 4 hours. Short-acting insulins. These insulins take about 30 minutes to reach your bloodstream, reach their peak effects in 2 to 3 hours and last for 3 to 6 hours. Intermediate-acting insulins. These insulins reach your bloodstream in 2 to 4 hours, peak in 4 to 12 hours and work for up to 18 hours. Long-acting insulins. These insulins work to keep your blood sugar stable all day. Usually, these insulins last for about 18 hours. How is insulin taken? Needle and syringe. With this method, you'll insert a needle into a vial of insulin, pull back the syringe and fill the needle with the proper dose of insulin. Insulin pen. This device looks like a pen with a cap. They come pre-filled with insulin or with insulin cartridges that are inserted and replaced after use. Insulin pump. Insulin pumps are small, computerized devices, about the size of a small cell phone that you wear on your belt, in your pocket, or under your clothes. They deliver rapid-acting insulin 24 hours a day through a small flexible tube called a cannula. The cannula is inserted under the skin using a needle. The needle is then removed, leaving only the flexible tube under the skin. Artificial pancreas, also called a closed-loop insulin delivery system. This system uses an insulin pump linked to a continuous glucose monitor. The monitor checks your blood glucose levels every 5 minutes and then the pump delivers the needed dose of insulin. Jet injector. This is a needleless delivery method that uses high pressure to send a fine spray of insulin through your skin. Insulin injection port. This delivery method involves the placement of a short tube into tissue beneath your skin. The port is held in place with an adhesive patch. You use a needle and syringe or insulin pen and inject the insulin through this port. The port is changed every few days. The port provides a single site for injection instead of having to rotate injection sites. Insulin inhaler. Inhalers allow you to breathe in powdered inhaler through an inhaler device that you insert into your mouth. The insulin is inhaled into your lungs, then absorbed into your bloodstream. Inhalers are only approved for use by adults with type 1 or type 2 diabetes. Surgery for diabetes. Pancreas transplant. However, getting an organ transplant requires taking immune-suppressing drugs for the rest of your life and dealing with the side effects of these drugs. However, if the transplant is successful, you'll likely be able to stop taking insulin. Pancreatic islet transplant. In this transplant, clusters of islet are transplanted from an organ donor into your pancreas to replace those that have been destroyed. Bariatric surgery. It is another treatment option that's an indirect treatment for diabetes. Bariatric surgery is an option if you have type 2 diabetes, have and considered a good candidate for this type of surgery. Much improved blood glucose levels are seen in people who have lost a significant amount of weight. Prevention. Type 1 diabetes can't be prevented. But the healthy lifestyle choices that help treat prediabetes, type 2 diabetes and gestational diabetes can also help prevent them. Eat healthy foods. Get more physical activity. Lose excess body weight.